Hello, I'm Xinqi He, a doctor in Renmin Hospital of Wuhan University. Let me introduce the corresponding author, Professor Honggang Yu. He is the director of Department of Gastroenterology, Renmin Hospital of Wuhan University, and also the chairman of Big Data Group of Chinese Society of Digestive Endoscopy. I'm honored to introduce a paper titled Real-Time Use of Artificial Intelligence for Diagnosing Early Gastric Cancer by Magnifying Image-Enhanced Endoscopy, a multicenter diagnostic study with videos. Gastric cancer is the third most lethal malignancy worldwide. The 5-year survival rate of gastric cancer is around 20%, while that of early gastric cancer could exceed 90%. As we all know, early detection, diagnosis, and treatment are key strategies to improve patient survival, and endoscopy is one of the most common and important procedures in the detection of early gastric cancer. In recent decades, magnifying image-enhanced endoscopy, including magnifying narrowband imaging and blue laser imaging endoscopy, which clearly present mucosal, microvessel, and microstructural changes, have been developed and widely applied to improve early gastric cancer diagnosis. However, the diagnosis theory of magnifying image-enhanced endoscopy is complex, which requires endoscopists to be armed with rich experience and thorough knowledge. The paucity of experts makes endoscopy recognition of early gastric cancer a great challenge in clinic. Therefore, it is important to develop a feasible and reliable method to remind endoscopists of possible early gastric cancers. Thanks to the remarkable progress in the application of artificial intelligence in medical image recognition in recent years, we conducted this study using deep learning models to develop an artificial intelligence system called Endoscopy to diagnose early gastric cancer in magnifying image-enhanced endoscopy. The system was trained and tested in image and video data from 3,099 patients across 7 different hospitals and evaluated its efficacy in 3 levels, including retrospective still imaging, real-time videos, and prospective consecutive patients in clinical practice. Magnifying image-enhanced endoscopy images obtained from Renmin Hospital of Wuhan University were used as internal image tests, and the external images were from Central Hospital of Wuhan, the People's Hospital of China Three Gorges University, Yichang Central People's Hospital, Jinmen Petrochemical Hospital, and Xiaogan Central Hospital. Stored videos from Renmin Hospital of Wuhan University and Peking University Cancer Hospital were used as internal and external video tests. To assess the applicability of Endoscopy in clinical practice, a prospective study was implemented in the Endoscopy Center of Renmin Hospital of Wuhan University, and consecutive patients receiving magnifying image-enhanced endoscopy were enrolled. The system achieved good and stable performance in all tests. The diagnostic accuracy of endoscopy for diagnosing early gastric cancer was 88.44% and 90.49% in internal and external images respectively. In 93 internal videos, endoscopy achieved an accuracy of 90.32% for diagnosing early gastric cancer, significantly superior to that of senior endoscopists. In 94 external videos, with the assistance of endoscopy, endoscopists showed improved accuracy and sensitivity. In 194 prospective consecutive patients with 251 lesions, endoscopy achieved a CST of 92.59% and an accuracy of 83.69% in real clinical practice. In the next step, real-time use of endoscopy in multi-centers should be further investigated to provide sufficient evidence for its performance in clinical practice, and the effectiveness of endoscopy on improving diagnostic performance of endoscopists should be further explored using enough samples. In conclusion, We conducted an ME to diagnose early gastric cancer in magnifying image-enhanced endoscopy and validated its effectiveness with multicenter static images, real-time videos, and a prospective clinical trial. It achieved better diagnostic performance in internal and external imaging and video datasets than senior and junior endoscopists. It was robust and valid in prospective clinical trial. ME showed great potential for early gastric cancer diagnosis under magnifying image-enhanced endoscopy in real clinical practice. Thank you.